Hello and welcome to our stellar group of panelists and our audience, including those joining us on ft.com and through LinkedIn for this particular session. Now, we've all lived through 7 or 8 very difficult months in which we've really seen the limits of our ability to control nature and fight an enemy that thrives on human interaction and policymaking shortcomings. In this session, we're going to be discussing the lessons we've learned about how to tackle the next pandemic and also the next phase of this pandemic. Many of us are again living in lockdown. We don't know how long that's going to last. The second wave hasn't peaked yet, and the numbers about this virus are still sobering. The total of global infections is now nearly 51 million, and the daily death toll from coronavirus around the world is over 700,000. That's higher than the peak it reached in April. So this remains very real. We'll welcome your questions. You can submit questions in the audience via the chat box on the right side of your screen, or if you're on LinkedIn, you can put your questions in the stream there. We encourage you to do so. So let's get started with the big news, the big virus news of the week. Positive news from Pfizer and BioNTech that their own coronavirus vaccine has proved to be 90% effective in clinical trials, meaning that 90% of the people who got it developed immunity to the virus. This has generated a euphoric reaction. We've certainly seen that in the stock market. And I'd like to turn first to Yvonne Doyle of Public Health England to ask you, Yvonne, whether you feel that reaction is justified or in any way overblown.
Thank you, Barney. Well, I think it's perfectly understandable that people are looking for hope, and it's been impressive the speed at which these vaccines have been developed. It's one of a series, a number, and I think it is reasonable for us to be optimistic that a vaccine or other vaccines will also appear during this pandemic and will be of use to the population. And there are several things about this that just need to be taken with just some modification. The first thing is that it requires 2 doses, and it will be not available to the mass population quickly, because even if it passes through its various stages of review and then licensing and so on, there will be a priority list of, certainly in the UK, of the population who will be in line to get this first. And that would happen over the coming months. So we're looking at several months. There's quite a logistics involved in getting it out and about, and particularly the transport of this, storage. And we still need to know more about whether it works in people who are asymptomatic, and whether it actually prevents transmission or simply protects the individual. But overall, good news.
Yvonne, thank you. Anders, let me turn to you in Sweden. Do you think this means we're now at the beginning of the end of the pandemic, as some have said, or is it a longer road ahead than that?
I can echo a lot of what Yvonne said. I think we have the same things that we need to understand before we can really say what kind of effect this vaccine will have on the spread of this. No, this is unfortunately not the beginning of the end. This is going to take a long time. I think at least in Sweden, we calculate with what we know we might receive, that vaccinating to stop the spread of a pandemic, we're talking at least 6, 7, 8 months before we are there. We hope we can protect our risk groups with this vaccine when it comes, but that will definitely be our first choice. So it will take quite some time before this can really mean something for the restrictions and other things we live under right now.
Thank you. Marc at Thermo Fisher, Yvonne and Anders have mentioned some of the things we don't know about the vaccine yet. Another thing we don't know is how long immunity lasts. How big a question mark is there over how long anyone who's got this vaccine will actually remain protected?
From our perspective, our role is to assist in the development and manufacturing of vaccines. And, we're supporting actually about 250 different projects, and we're ready to scale up. In terms of understanding the immunity profile, obviously that's going to be critical because it tells you really whether, this is, the first new tool in the fight against the pandemic, and we need many other tools, or that this tool will be a tipping point. I just don't think we have any idea yet of what the duration of immunity is. That's a lot of the study work that needs to be completed.
Martin, let's talk a little bit about distribution. We've seen a scramble for access to many of the vaccines that are in development. Just in the last hour, I think the European Union has announced that they've signed a deal for 300 million doses of the Pfizer-BioNTech vaccine. It's all been very ad hoc. What does the world need to do to ensure that there's fair distribution of this vaccine or any other future vaccine?
I think this is a really important issue, Barney. I think, you know, my reaction, my family's reaction when the news came through, everybody's going, this is fantastic news. But to echo everybody else's comments, great news, but it should have been accompanied by a very big but. But we still need everybody to comply with social distancing. We still need everybody to wear masks. We still need to abide by the rules and guidance issued by our governmental authorities. So, because there are many challenges, Barney, one of which is logistics. Well, a key one of which is how do we evenly distribute this and other vaccines? To Marc's point, or Yvonne's point, this is just one of many vaccines that will be coming through. For the vast majority of people on this call, it will have no impact whatsoever because we won't be getting it, and rightly so. So the question then is, how do we distribute this and other vaccines to people in need and to avoid what we have so far experienced, which is not a global response, it's been a very national response. And if we distribute vaccine nationally, in other words, looking after our own self-interests rather than those who genuinely need it, we will be back in this situation again. So that whole process of logistics, cold chain management, which is considerable for this particular vaccine, maybe less for future vaccines, that is relatively easy compared to how do we decide ethically and morally where we distribute this vaccine so that it's more it is indicative of international collaboration rather than national protection.
And Martin, let me also ask you about public attitudes. I'll quote a figure from a survey the Pew Research Center did in the United States on people's willingness to get a coronavirus vaccine. They found that 49% of people said they definitely or probably would not choose to be vaccinated. So half people saying they would probably not choose to be vaccinated. Some of those people may be concerned that a vaccine developed at record speed may not be fully safe. Do those people have a legitimate worry there?
Absolutely. And I think first and foremost, we need to not be talking to people who are hesitant about taking a vaccine, but actually listening to them. You know, if people have genuine concerns, we need to understand the reasons why. And I think the debate, Barney, needs to shift from, you know, so far it's been, and understandably so, it's been focused on where is the vaccine, when is it coming? And what hasn't really been debated is the process of vaccination. And we want people to willingly accept vaccines based upon trust. And governments globally need to be really, really focused on how do they build trust, not through their communication or through the communication from scientists, because actually the levels of trust with political leaders and unfortunately members of the scientific community have been eroded considerably. And we've got to figure out a way of how do we engage local leaders, community leaders, religious leaders, student leaders, social media leaders and influencers, people who are trusted by their communities to actually listen to concerns, address those concerns. Otherwise, we will have a vaccine, but we're at risk of not enough people taking it for it to be effective. So the debate it is a very real concern. I think we're late in addressing it. We've got to start now. And it is a process of top down and bottom up, really with a view of listening to concerns, not lecturing people, understanding those concerns, addressing them, and allowing people to make an informed decision based upon knowledge, not being told what to do.
Thank you. Let's turn to the subject of lockdowns and come to you, Anders. As I mentioned, many of us are living in lockdown again. Sweden is not. You've led Sweden's response, and Sweden's obviously stood out in Europe for not implementing a full legal lockdown at any stage of the process. You predicted back in May, I think, that we'd end up in a second wave. That's what we're experiencing now. You said that by that point, Sweden would have a high level of immunity and a lower number of infections than some of its neighbours. But at the moment, I think Sweden's being hit very hard. Some of our own analysis here at the FT shows that the level of hospitalizations from coronavirus are rising faster in Sweden than anywhere else in Europe. So are we seeing now that your strategy didn't work as you hoped?
No, I wouldn't say that. I mean, this is really a long-term haul, and what strategy is going to hold all the way and not going to hold all the way still remains to be seen. And I think any strategy you start with constantly has to be adapted. I think the level of population immunity or herd immunity we're going to have and we're going to need to this disease still remains a big mystery, to me at least. It's very difficult to understand how many in a population actually have immunity and who have not. Maybe because it's so unevenly spread in populations. I mean, we know that in certain areas of Stockholm, we have a high level of immunity, in other areas, none at all, basically. So we are adapting our strategy to this. We are keeping mainly the same restrictions in place still. And I think that's more what's important in our strategy, that we're looking for a long haul, that we're looking for a sustainable strategy. And I think that has worked reasonably well so far. And yes, we see the numbers increasing from very low levels. So, I mean, we still have, I think, 75 to 80% of ICU capacity left. So there's a long way to go before we hit any roofs on that. But of course, it's a concern. I think it's rising quicker than many other places because it started rising later in Sweden than in many other places. So it's always difficult to compare countries in this, I would say. But we are concerned. We are trying a lot of things right now to try to slow down the spread. We haven't had a formal lockdown in place, but in many ways, people have acted like there's been a lockdown. We can measure traffic, working from home, many things like that. And we can see that people in Sweden really changed their behaviors quite a lot. And I know there are some European surveys saying that Swedes maybe changed their behaviors even more than people in other countries who had formal lockdowns. And I think I'm understanding a lot of what Martin's saying. That's very much the way we try to work. We're trying to have a dialogue with people, trying to get them understand what are we trying to achieve together, and letting them order their life around that. And I think that has been reasonably successful during the summer. Now we have a slight turn down during the fall. We are trying to rectify that by going out, communicating even more, looking into what people now don't completely understand, that they don't seem to completely understand that private parties are also dangerous, not only going to restaurants. And when we're communicating that, we can see responses. It's going to be a long fight for all of us. And I think we're all going to have to adapt as we go along, because there's a lot of things we don't know yet.
One of your counterparts, Anders, in the city of Uppsala, a public health official there, did call recently for a formal national lockdown. Are you open to considering that idea, or are you opposed to it on principle?
No, we're not opposed to anything on principle. I think that's a completely wrong idea to have about this disease. We're trying to adapt as we go along. I think he's worried. I mean, he's the head of the infectious disease clinic. Of course, he's worried seeing more and more patients coming in. We just instituted a new set of regulations and advice to the population in Uppsala 2 weeks ago. We know that's far too early to say anything about that. We can follow attendance to shops, traffic in Uppsala, how many people are working at home from Uppsala, and we see all those figures going the right way. People work from home a lot more. They don't go to shops anymore. And we do believe that those changes in behaviors will, in a week or two, also affect the situation in Uppsala. We can see numbers that are stabilizing a little bit by now. But I understand his concern. When you're sitting there at the hospital, remember what happened this spring. Of course, you're worried.
Yvonne, let me turn to you. Do you feel that we now know what kind of lockdown is most effective in reducing transmission? Is it closing non-essential shops? Is it closing pubs and restaurants? Is it schools? Or are we still in the trial and error phase where we're trying to work out what works best?
Well, Barney, I think we're to be humble about this. We are still in a novel virus pandemic. So we're still learning both about the virus and about how people behave and about the interaction of virus with people and so on. So there's a huge amount of learning. And I agree with everyone who said that we've quite some way to go to fully understand this. And the second thing that's come from this discussion is the importance of trust with the population. You must have a partnership with the population. And the more local the actions are, the better in that. And what we've found here is we've learned as the months have gone on, first of all, an awful lot more about how people live their lives. I mean, we in public health, we thought we could work this out from data. Did we know? We know by how the virus has actually found its way into various communities and why. The why is terribly important and what can be done about that. And as the months have gone on, we've seen a much more regional expression of this pandemic, particularly in the north of England. Now, in the spring, it was much more prevalent in London, and we knew that at one stage about 16% of our population in London had antibodies. That, of course, now has waned. But now, through the summer and the autumn, we're looking at the north and the Midlands of England, and lives are very different in the different regions. And as Anders has said, we have had to evolve our strategies for that. So, you know, some people may question, well, why is it different in, say, Liverpool to where the east of England? Well, the people are different, the lives are different, the virus has behaved differently there as well. It has found its way into places, and we've had to adapt, and that can be quite difficult to explain. It needs very good communication, but it also needs very good local intelligence. So what we have done particularly better this time is to work with our local authorities, our local directors of public health, and our local public health England protection teams, because they know their communities very well, and they know how things play out in different regions. And then working with the scientists nationally to understand what is it that we need to do next to actually slow this virus. So you asked me what has worked. What has worked is a package of measures. There isn't a silver bullet in this. It is terribly important that people do their social distancing and behave in ways that, you know, we know scientifically are important, particularly in indoors where ventilation is poor and so on. But also that we have a range of support to people. So why do people not comply? Because sometimes they can't afford to comply. So the furlough schemes and the support to people who are self-employed, or particularly who are on 0 hours contract, has been crucial in the poorer areas to help that compliance. And finally, understanding what people are thinking. So we know in this country there is a good deal of support for the measures that have been undertaken, and people are complying, and they're mainly complying. We need to thank them for doing that, because it's hard, and understand those who don't and why that is and how they can be better supported.
Yeah, Martin, let me turn to you just to talk about travel restrictions. New Zealand, of course, is one of the countries that's done very well in controlling the virus. One of the things it did was close its borders very early. In Europe, a lot of us were allowed to go on summer holidays, and it seems that that supercharged the second wave. Should we be ready to deploy more bans on international travel to prevent any future pandemics like this one?
I think you rightly point out, Barney, that, you know, you look at the regions and the countries who have controlled this well, New Zealand, Australia and others, they took that very bold step, and they are now benefiting from that in terms of reduced cases and GDP returning back to relative normal. So I think we must do the same. And I think on reflection, hindsight's always 2020, we took our foot off the pedal too soon. Understandably so. You know, you can understand people's frustrations, but we are paying the price for that now. And I echo everything Yvonne said earlier around, you know, going from that centralized control to regional communication with communities to understand the challenges of lockdown. And I can't really add anything other than what Yvonne already has communicated. But what I will say is lockdowns are only effective, and it leads us into another item on the agenda, if you have effective track, trace and quarantining procedures. I think people are prepared to take that pain, providing they see benefit long-term in numbers coming down. So lockdown without effective track and trace, and the characteristics of those other countries that have got this under control was, they locked down, they shut down international travel, but they all had effective track, trace, quarantining systems. So that is really, really key, because going into this lockdown was different. People are angry, they're frustrated, they are tired. And I struggle, if there's a third lockdown, that's going to be a real push. So the focus must be on how do we implement an effective track, trace and quarantining system so that we're not here again.
Yeah, thank you. Let's turn to the question of testing and come to you, Marc. Thermo Fisher is obviously one of the biggest players in COVID testing. I think your company has the capacity to produce 20 million tests a day. We know that lots of countries have struggled to ramp up their testing capacity. What have been the big bottlenecks, and what can we do to try and loosen those bottlenecks for the future?
Yeah, Barney, in terms of, testing, obviously it is a key part of how you fight the pandemic. Obviously, social distancing, good hygiene, wearing a mask is obviously the most critical. And then testing gives you the information on how do you actually ultimately quarantine or, bring medical treatment that you need. And, a lot of the headlines around testing were in the early phases of the pandemic when there was actually no tests, no capacity, and all of those things. But if you look at it today, we produce 20 million kits a week. We ship to the world. And labs have scaled up their capacity to do PCR testing, which tells you whether or not you have the virus actively. And most countries are able to get what they need, right? Now, there's a question about, are we doing enough testing and should there be more capacity? And I think that's country by country, there's a strategy around that. And I think my own view is those countries that have put a lot of infrastructure in place to be able to test quickly, get good turnaround times, and then ultimately do the track and trace have responded better than those that have struggled to scale up. But I think that the test manufacturers have really ramped up capacity to meet the needs there. And the good news is there's other types of tests for different use cases. There's some of the back to life available type testing. There's antigen testing as well. There's antibody testing to tell whether you had the virus. So the medical community has a lot more available tools to it to understand what's going on.
Well, let me pick up on that point about antigen testing. These are the so-called rapid tests that can often give a result within 10 to 30 minutes because it doesn't require any lab processing. Your PCR tests need to go to the lab. The downside on antigen tests is they're not as reliable. However, they would allow more mass testing. Do you think we should be embracing antigen testing despite the question marks over the reliability?
I think that different test types have different applications, right? And from my view, there have been many countries that have been able to get turnaround the next day on PCR testing. So if you want extraordinary accurate testing, many countries have done that. But there are applications for very quick testing where you want to be able to, screen a patient if they're positive or not, and then do a confirmatory test. So, and there's some back to life aspects of things where, you really do want the information very rapidly and understand that you might be getting 80 or 85% accuracy, which isn't ideal, but it's better than not having any, information. So I'd say there's different use cases from the different test types.
Anders, how about from your perspective, would you like to be able to use antigen tests to get a better picture of immunity, even if they're not perfect?
I mean, maybe not to get a better picture of immunity, but I definitely think there's a role for antigen testing in certain cases. I think like in primary care, where you test people with very mild symptoms, and that if the test is not 100% reliable, maybe not all that important, because if you miss a few, it doesn't really matter too much to the spread or to the patient. So there is definitely a role, and probably in the long term, we need to move the testing out closer to the patients, to the population, which means that they need to go to primary care, and we need to have a quicker turnaround. So I think, and I then definitely think that antigen testing will be what we're going to use in those circumstances in the long term, because once again, this is going to be a long-term race, and we're going to need a lot of tools down the road. And PCR has helped us a lot, but it has special challenges. So I think to have antigen testing as a complement will definitely be useful.
Yvonne, the UK is one of the countries that has struggled in a way to ramp up its testing, but let's look forward. I'm sorry to say that the next pandemic, the cause of it is probably out there already. We just don't know what it is yet. How does the UK or any other country develop the testing infrastructure to be ready for a pandemic that it doesn't even know what it is yet?
Well, the first thing is to learn from this pandemic. And I think there was an early recognition that we needed much more capacity for testing. And that has actually, people keep using this word ramped up, but it has augmented hugely. And, I do commend the test and trace system for that. A fifth of the population has been tested since May. And there are bigger ambitions to test even more. And I agree, by the way, with the points that Marc and Anders have made, that, the point of care tests can, need to be applied first and foremost in the circumstances for which they're most useful. For instance, workplaces that are critical infrastructure want quick results, not to take the whole workforce out. And, rapid testing is very helpful, but, if there's doubts, then confirmed by PCR. So I think we will get better and better at this. The issue, about where is the next pandemic is a broader question. And it's likely to be a zoonosis because most of our major problems in the past decade and beyond have been zoonosis. So we need much better collaboration internationally, I think, for surveillance between animal health and human health on surveillance. I think it's very good in countries, but perhaps less so between countries. And this time round, I think we have the opportunity to set that collaboration up. And by the way, I do commend the vaccine collaborations that currently exist, because I think that has allowed us to get where we are at the moment. But we could learn from that too.
Well, you mentioned the subject of international cooperation there, so let's stick with that. This is obviously a common problem, and there are probably common solutions. It's not necessarily been the best example of multilateral cooperation, and indeed the head of the World Health Organization has said that the response has been delayed by the lack of collaboration between countries. We know that the US under President Trump has vowed to withdraw from the World Health Organization, and that President-elect Joe Biden is going to take a very different approach. So Martin, let me ask you, do you think US leadership on this pandemic could actually change things for the whole world?
I do, Barney. I think, there's a commentary the other day that this is the first global crisis that the US has not, unfortunately, taken leadership of, and I think we've missed out as a result of that. And what I find fascinating with this whole of this debate, the debate so far, Barney, is about the treatment and reaction to. We should be really, really focused on prevention. We do not want to be here again. And, the playbook for pandemic prevention is actually pretty straightforward. If we imagined it had 10 chapters, the first 7 chapters would be entitled Prevent, 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 Prevent. We have thousands of microorganisms with pandemic potential, and we've got to address the root causes, and the root cause is climate change. We will fix this pandemic, but unless and the clock is ticking on climate change to the point where we're getting beyond the return on that, to tackle climate change, that tackles the deforestation, that brings animals closer to human beings, that leads to as Yvonne said, those zoonotic infections that lead to pandemics. So that level of prevention requires international collaboration, it requires international knowledge sharing, it requires global leadership and a very big dose of global humility so that we can actually learn from each other. And importantly, institutions that drive this. And no doubt we'll come on to WHO later. Governments change. This, after the Second World War, we put in institutions, WHO, NATO, and so on, to ensure that it never happened again. And the debate needs to shift to how do we ensure we're not here in a year's time saying, a same conference saying, why didn't we learn? So it's about the global collaboration, the global cooperation, making sure that we tackle the root cause of pandemics, namely global warming, and making sure that we have strong institutions so that when governments do change, those institutions remain so that we're not sat here in a year's time, 2 years' time, because this is going to happen again unless we tackle root cause and put global institutions in place to ensure that the preventive measures are there.
Martin, let me ask you a couple of questions about China. In fact, one member of the audience has asked, what can we learn from the way China's dealt with the pandemic? On top of that, I'll just remind people, that, of course, that there's been some criticism of China for not disclosing early and comprehensively what it knew about this virus. And my question on that is there a mechanism to force sovereign countries to provide better information sooner when they face a new pathogen like this?
I think the answer has to be yes. The question then is how, and it really comes down to those institutions that the WHO, I think, has done, bearing in mind, with a budget of 2.4 billion, which is the same budget as a city hospital, the WHO has done a reasonably good job given its constraints. However, its legal framework, its ability to influence and direct countries is actually very, very limited. So I think China contained it very, very well. How do we enforce or enable countries, whether it be China, Singapore, or any of the other Asian Pacific countries in future outbreaks? How do we ensure they notify quicker and faster? Then that has to be, in my opinion, driven through, whether it be WHO, by actually looking at how we modernize that organization in light of this pandemic to make it more fit for purpose and to fund it correctly.
Yeah. Anders, let me ask you, Sweden has a population of just 10 million people. How is what you're able to do affected by what the biggest powers in the world are doing when it comes to fighting a pandemic?
Of course, I mean, everybody is affected by everybody, and I completely agree. We need to have a strong WHO that helps us in this. And unfortunately, this has not worked, as some of you already said, has not worked very well during this pandemic. I mean, collaboration has not really been there the way it was just in the last pandemic, the swine flu pandemic. The collaboration was a lot better at that time. Exactly why we didn't manage this time, I think that's a political question. I'm not quite sure what the answer would be. Sure, prevention is important, but even with the best prevention in place, still something is going to slip through now and then. And it's not only about prevention, it's also having a management and a way to deal with it on an international level, where we can collaborate a lot better, learn from each other a lot better, collate data a lot better on the international level than we have done so far, because I think we could have learned more quicker if we had been better at collating our data. And we could also learn more about what preventive measures and so on had worked better if we could have worked more together. I don't know if New Zealand and Australia is such a good examples. If you live in a place like Sweden where people travel across the borders all the time, there is no way we can close down Sweden. That would not be sustainable for many months. It will have drastic effects on everything in Sweden, including public health. So we need to find ways around that works without closing our borders. We followed travel during the summer in Sweden. Travel did not seem to affect the spread in Sweden very much. We had a very uneven spread before the summer and an uneven spread after the summer. So there is still a lot of things we don't know, and we don't completely understand why things seems to be working in some places and not in others. It worked well in New Zealand. Iceland now has a major outbreak. So it's a tricky disease in that way because it behaves so different in different contexts the whole time. And that makes very difficult to completely understand what we should do to be able to handle it well. But international collaboration, Sweden has always been a great friend of WHO, and we will continue to be that. And I think we really need to once again think about what kind of WHO we all want, so we can make it even better in the future.
One of our audience members has asked a question related to that. Do we need a coordinated international system that has a real budget and real emergency powers? That would obviously take things beyond where we are now with the WHO. What do you think, Anders?
I'm not so sure about that, because there will always be countries who will not adhere to that. I mean, we're all sovereign nations. And I mean, this is a constant debate we have in Europe. How much power are we willing as nations to give to some kind of a supranational institutions? And I think we'll keep on questioning that. And we a little bit come back to Yvonne said, how important it is to work locally, and to how important it is to sort of really direct and adapt things on the local level. So you need to have a balance. I'm sure we need to have some kind of organism, international, that can help us. But steering, I'm not too sure about. I think that many things need to be steered at the local level, because that's where the political power is, that's where the money is, that's where the resources is. It creates a lot of problems to try to believe that this can be managed on by some kind of, international organization with a lot of power. I don't think we are really ready for that as a global community yet.
Right. Marc, let's come to you to come back to the question of the next pandemic that may be looming. How do we set up early warning systems, early detection systems, so that we don't get caught out as we have been in the last 7-8 months?
Yeah, from my perspective, let me make a quick comment on collaboration, because it's the one that's not in the headlines. I'll talk about the preparedness. From a multinational company's perspective, right? We're the largest in our industry. And what the practical perspective means, we're also the largest domestic producer in most of the major countries around the world, right? And without the headlines, actually the collaboration to the UK, China, US, Singapore, Germany, etc. It's actually very good. Like any request we had explaining rationale, governments were actually quite responsive. They understood the interconnected nature of the world and actually coordinated pretty effectively. That's different than sort of the national policy. So actually that early phase of the response actually was very encouraged by. All right. When I think about how do you prepare for the next, the thing that surprised me, because we've supported public health labs around the world for forever, is how fragile the infrastructure was, right? And how under-resourced they were. And many countries, one of the roles we did sort of in those first months is we went to universities and borrowed equipment to move them to public health labs to help scale up, right? Something that never in my 25 years of doing this would ever be contemplated, that, you know, there wasn't enough, you know, preparedness, you know, in the national infrastructures around the world to respond. And I think the funding environment there, the basic infrastructure investments, that sharing information across borders is going to need to happen more quickly for this to the next one to get controlled faster. I'd say that would be my observations sitting here in November. I'm sure we'll learn a lot more over the coming months as well.
Yeah. Yvonne, let me turn to you on that point. You're part of the public health infrastructure in the UK. What changes do you think are needed to reinforce, boost that infrastructure so it can be ready for the next pandemic?
Well, there are many things to learn from this one. I think there's no doubt that the infrastructure will be strengthened and will need to be. But also, you know, it goes beyond that. I think we need to build on what has worked, I think, well, but needs perhaps enhancement, which is surveillance, good international surveillance, cooperation with the international health regulations, and, you know, international credibility of organizations that can help with that, while strengthening much more the reliability, the reliance on local systems and the trust of local systems to actually give you that local, you know, trust with populations as well. I think there are a couple of technologies that have been very interesting. Anders has said about the holidays and how it affected Sweden. Actually, we realized through the use of our genomics that holidays were having a profound effect. During midterm, in the spring, we had over 1,400 introductions, separate introductions to the country. And during the summer holidays, again, people love to travel. Countries differ in this way, and they spread around quickly. And you know, the use of some of the technologies to understand the implications of that quickly in populations would be helpful in the future. So I think there are many things, but if I could just have one final word, the way people live for me is a really profound finding of this. And before this epidemic, we were quite worried about the way people are getting their food, the food chain, and how complicated the food chain is if anything goes wrong with it. You know, now we have learned so much about how people's lives have enabled a pandemic to really run rampant. And I think we need to rethink a little bit in the light of climate change, in the light of vulnerabilities, in particular for people living in cities. What can we learn about this to make us more resilient for the future?
Thank you. Martin, I'd like to come to you. We've got a question about Africa, which I think is very relevant. And I know you've advised governments around the world. The question is noting that Africa in general has had a lower mortality rate compared to the number of infections. Do you have any thoughts on why that is and what lessons we might learn from the African experience here?
Probably Yvonne would have a better idea of this than me, Barney, but my understanding is that, you know, the African population, first and foremost, is a lot younger. Unfortunately, you know, decimated by HIV as a continent. So that population probably more robust, more resilient. You know, whether the levels of reporting are adequate, I simply don't know. But I think certainly the demography in Africa is very different, and whether that has had a significant effect, I don't know.
Well, Yvonne, I'll invite you in to offer any thoughts on that, and also throw another question at you from the audience about young people. Has communication with young people been effective enough? The question says, we're giving up so much freedom for a virus that hardly impacts us.
That to me, Barney.
Yes, to you. Yvonne.
Yes, it is. Right. So it's been really interesting looking at how this virus has played out with young people. I think what I'm looking into the future now about the cost to them and the bills they'll be paying for a long time to come. If we don't have a good recovery and if we don't actually enable people, particularly with a focus on inequalities, to ensure that we help people to get back on their feet, that we look at the way people stay healthy, and that we actually encourage a healthy economy as well, because in public health terms, jobs are important for health. Good jobs are important for health. And also we might just want to look at why people put themselves so much at risk during this pandemic to keep themselves afloat. And what does that say about the nature of work and the future of work?
Thank you, Yvonne. We've got about 4 minutes left, so I've got a final question that I'd like to put to all of you. Let's remember that 12 months ago, very few people were talking about a pandemic like this. Some were epidemiologists, and perhaps they weren't talking loudly enough, or perhaps they were, and they were being ignored. So I'd like to ask you all, what's the thing you're worried about now, that perhaps the threat you're worried about that perhaps is not being talked about enough, that you think the world should be paying more attention to vis-a-vis this pandemic or the next one? Anders, let me start with you on that.
There is, of course, always the unknown. And as I said before, this disease continues to surprise us, and it will probably surprise us again. But right now, I think what we haven't talked too much about is the side effects of lockdowns, all the different measures we have had put in place, and what effect they will have on public health and how we can alleviate them in the future, not least when we come to the question of equity, because we see that this pandemic, as almost all other diseases, really hits the worst people, the people that are worst off socioeconomically already. And it will most probably make the world less equal in public health as in many other ways after this. And we really need to start working on that, I think, as soon as possible to stop that from being more than it absolutely has to be.
Marc, how about you? What risk or threat are we perhaps overlooking?
Yeah, from my perspective, I'm always optimistic that there's a lot of lessons learned that'll get applied that will make the world better. I actually am very worried about all of the doctor visits that haven't happened over the last 8 months and the unintended effects on the health of the population because of that. Cancer doesn't wait because of a pandemic, and these things. Getting people back to the doctors and the more routine health checks, I'm very worried that this is going to have a much more profound impact on the population going forward. So that's been top of mind for my perspective.
Okay. And Martin, what's on your mind?
I'd echo everything that the other speakers have said, Barney, but what's on my mind, my biggest fear is that we don't learn from this. My biggest fear is that everybody said, we miss the opportunity to change the picture moving forward, and it all comes down to where must we invest now or pay later. So it's all words are one thing, actions are completely different. So what I'm fearful of is the words not being translated into action, in particular where we need to be investing money to ensure this doesn't happen again. Investment in public health systems, investment in research and development with a focus on innovation targeted towards prevention, and solid cash put into a global emergency response, global surveillance systems, global track and trace systems, and global investment in institutions, non-governmental institutions, to hold our governments accountable so that we're not sat here in 5, 8, 10 years' time, because those bugs are sat out there.
Absolutely, absolutely. And finally, Yvonne, to you, is there any particular threat or risk that you think we're in danger of overlooking?
Please don't forget inequalities that have arisen here that have been augmented. That is the terrible price to pay. But on an up note, I think it would be wonderful if we spotted the economic opportunities that we've learned about during this pandemic, and we moved to a greener economy.
Great. Well, with that, we're going to wrap things up. Thank you to all of our panelists. Thank you to the audience, especially those who submitted questions. To people watching on FT.com and LinkedIn, you can follow the rest of the sessions on the website globalboardroom.ft.com. And on that same site, you can find a recording of this session. So thank you all. And with that, I'm going to hand it back to the FT studio.
Well, thanks so much, Barney.